Dr. Sudhir Reddy. I'm an orthopedic surgeon with 30 years of experience. I trained in some of the best institutes in India and the world and worked in some of the developed countries in the world. So my main area of practice is osteoarthritis of knee wear and tear of the knee. That is what I treat every day. So I am a qualified person to talk about this. Why am I doing this video? So you would have come across now about several advertisements, several probably WhatsApps, YouTube messages saying that there are new treatments, new injections that have been found called PRP or plasma therapy, which are miracle drugs, which when you take those injections, your cartilage will grow back and you will avoid surgery. You would have heard this several times. You would have seen this because I see every day so many patients coming to me. Some of them have received this injection, some of them are contemplating, so they keep asking me. So whenever we see this, we actually see we're actually so pained by this. We're outraged by this kind of advertisement because that is not the truth. So I want to clarify the role of PRP. What exactly is PRP? PRP is platelet-rich plasma. So some people even modified this because they are so smart that using PRP name, everybody is using it. I want to use some other name. So they've modified the name as plasma therapy. This is all fraud. So our body normally has platelets. Every ml of blood, we have about 1.5 lakh to 4 lakh platelets in every ml of our blood. Okay? So we have 6 liters of blood. So these platelets normally flow to every part of the body. We have a very, very efficient circulatory system. Wherever the platelets are needed, all the platelets in the body will go to that place and will give their services. So platelets have some secretory factors called platelet-derived growth factors. So there is a theory that wherever there is some damage, if these growth factors are given there, or if these platelets reach there, they will secrete these growth factors and they can help repair that process, which normally the body does. So some people have postulated that you take platelets with 10 ml of blood from here, segregate some platelets from there and then inject into knee joint or some other joint, and they will act there and they will grow cartilage. This doesn't stand scientific logic because you don't need platelets of 10 ml of blood. You have platelets from 6 liters of your own blood, which will naturally go to the damaged part, and whatever job they can do, they will do that. So this is 600 times more platelets than what you get from 10 ml of blood. This PRP has been around for last 30 to 40 years. Nobody has found it recently. Some people are claiming that they have found a new method. So this is all false. So this is being used in many areas, and there is some evidence that in some areas like tendons where blood circulation is low, when these injections are given, there may be some benefit. That's benefit of doubt. So sometimes if you give in some tendinopathy, it may be okay. But into joints, there is no evidence. Okay, and this is not a new process. So many people, so many doctors have used it for the last 30-40 years, and because there's not a promising results, the results are not good enough, many people have abandoned it. But every now and then some people will come, some people will believe in it, some people will promote it. Again, people's opinions change. But the worry this time and the fear this time is some people who, a lot of them are not related to arthritis, have no knowledge about arthritis, have no professional qualification to treat arthritis of the knee, for whatever reason, whether they are not able to succeed in their own area of specialization, they have started this scam that they have found new injections, and these injections, when given, cartilage will grow back and you will be able to save yourselves from surgery. Naturally, no patient likes surgery. Of course, surgery is a very expensive process, painful process. Sometimes things can go wrong. Sometimes things can go wrong, horribly wrong also. So no one will like surgery. Even surgeons do not advise surgery unnecessarily. Surgery is only required when everything else fails, when there is no other alternative, and that too after understanding all the risks and all the benefits, then only you should willingly, if you accept, if you understand everything, then go for surgery. And in right patients, for right indications, surgery performs very well most of the time. Okay? But it is not to be taken lightly. So no one likes surgery, everyone is fearful of surgery. So exploiting this fear and this dislike and this worry, these people have started this scam promoting these injections. So normally PRP is given by many people for the last so many years, and it is given for 5,000 rupees, 10,000 rupees, 15,000, 20,000, like that. So these people have now, on an industrial level, these people are advertising in newspapers, in paid media, in paid slots on TVs. They are going again and again promoting this scam, this fraud, and promising false results using digital media, WhatsApp, YouTube, bombarding the society with these messages, so that so many people, innocent people, people without medical knowledge, of course medical knowledge is very difficult to get. Most of the common public do not have enough insight into this. So many people are getting carried away by this, they are believing this, and they are actually selling their properties, taking loans, taking a lot of financial hardship, and giving these people 2-3 lakhs of rupees for these injections which have no benefit at all. This is the biggest medical scam today. This is the responsibility of all of us to expose this scam. What most of them do is, a lot of these PRP injections, they also mix with steroid. Steroid is a proven medicine to reduce pain when injected into the knee. So when you give this injection, you may get some pain relief. 1 month, 2 months, 3 months, 6 months, you may get some relief. So people are believing that these injections are actually working. But they also get to sign a consent saying that in many people this may not work. So we are aware of these risks. You sign a consent without you realizing. So if you go back to them and say that it didn't work, they will tell you that, oh, it is likely to work, take one more injection. Or if you finally question that it didn't work, then they'll say that for the vast majority of people it has worked. You are the only person it didn't work. So people are also not able to counter this, and they're accepting that it didn't work for them. So that is how this scam is spreading, and more people are falling victims to this. Another tricks what they do is, whether we have arthritis or whether we have wear and tear in the knee, how do we identify this? This is identified on X-ray. I have 30 years of experience. My main job is diagnosing and treating arthritis. I use X-ray. Every correct professional, every right professional, every knowledgeable person uses X-ray to see whether you have arthritis or not, because in X-ray, if you see gap, that means cartilage is there in the joint. If the gap is reducing, cartilage is wearing off. If the gap is completely obliterated, it means cartilage is completely gone. So, but if X-ray is there, you can also see. Patient can also see. Patient also can realize whether there is wear and tear, and can also realize whether with those injections, whether the cartilage has improved or not. So, to make you blind, to confuse you, they do something called an ultrasound. I cannot, with 30 years of my experience, I cannot read this ultrasound. I cannot understand this ultrasound of the knee. No orthopedic surgeon, I think, in my opinion, understands or needs to do this ultrasound of the knee. It makes no sense at all to do an ultrasound. So they do this ultrasound, and the ultrasound, it shows so many lines, so many shades, no one understands anything. They'll show you some lines and say that this cartilage is gone. And then 6 months later, they will do another ultrasound and show you another line, say that your cartilage has come back. They will not listen to your pain, whether your pain has improved or not. Oh, this ultrasound shows your cartilage has come back. This is a scam and fraud, so that you yourself cannot identify different things about platelet-rich plasma and its effectiveness. So we should actually look at the proof. We should look at the literature that is published in accepted and reputed journals. So I will show you the proof now. So we're going to look at a reputed literature to see whether PRP is a miracle treatment or actually a scam. So for the proof, we look at the published literature. Of course, literature is a vast area. There are several publications. Some are pay for publication also. You pay them money and it gets published. So you have to look at the credibility of publication. Are these very credible publications? Are these trustworthy? Okay. So this is a publication in something called the Journal of Bone and Joint Surgery. The Bone and Joint Journal. This is like a Bible for orthopedic surgeons. This is the most reputed journal published in orthopedics, and the regulations for publishing in it are very, very stringent, and whatever is published in it, you have to trust it. So the headline is the effectiveness of leukocyte-poor platelet-rich plasma injections on symptomatic early osteoarthritis knee. This is a randomized control trial. So what it actually means, I will show you. So this is, look at this. This is a double-blinded randomized placebo control trial. That means, placebo control means it is compared, PRP injection is compared with a placebo. Placebo means an injection where there is no medicine. It is just a normal saline is given. So whether when injection is given with no medicine, how PRP is working in comparison to it. It was performed with 3 groups. One group receiving just placebo, normal saline 3 injections. One group receiving 1 PRP injection followed by 2 placebo injections, and the third group receiving 3 PRP injections. The injections were given 1 week apart. So notice that. So this is a double-blinded control. That means the patient who received the injection does not know what is the injection that is given to him, and the investigator who is doing the study also does not know what is the injection that is being given to the patient, because the injection will come with a code only. He does not know whether he is giving a placebo or a PRP. So the bias is eliminated. The investigator bias and the patient bias is eliminated. So at the end of it, they will analyze each patient, what is the effect, and then they will look at different groups, whether this group or this group, any difference. So look at the conclusion. There is no evidence that single or PRP injection had any additional benefit effect compared to saline injection up to 12 months follow-up after treatment of early stage of symptomatic osteoarthritis of the knee. So whether you give a placebo injection or whether give a PRP injection, 1 injection or 3 injections, there is absolutely no benefit at all. So this is published in the Bone and Joint Journal, which is a Bible for orthopedics, which is a Bible for arthritis. So you must trust it. This is another important publication. It is called JAMA, Journal of American Medical Association. It is a very, very reputed journal. Again, the heading of this publication is Effect of Intra-Articular PRP Injections or Placebo Injection on Pain and Medial Tibial Cartilage Volume. That means cartilage thickness. Some of these people will tell you cartilage has grown, it has become thick. So this is exactly, it is again a randomized clinical trial. Okay. So when you look at this publication, among the patients with, when you look at the conclusion, among the patients with symptomatic mild to moderate radiographic knee osteoarthritis, the intra-articular injections of PRP compared with injections of placebo did not result in a significant difference in symptoms or joint structure. These findings do not support use of PRP for the management of knee osteoarthritis. Again, no evidence at all compared with placebo. This is again a systematic review. Systematic review means they will look at all good quality literature that is published, and they again looked at 3 types of injection: hyaluronic acid, corticosteroid, and platelet-rich plasma. These are the 3 common types of injections you will be offered for knee osteoarthritis. So the conclusion, available conclusion provides that, so for the treatment of knee osteoarthritis, general guidance from a global perspective concluded that intra-articular corticosteroid or intra-articular hyaluronic acid are favored for different needed responses. So for different conditions, some of these are useful, either corticosteroid or hyaluronic acid, and can be utilized. While PRP currently has no insufficient evidence to make a conclusive recommendation, that means PRP does not have evidence to recommend it for use. Again, you have to trust this. This is another trial, another flop. Again, it shows that this is again a randomized control trial. It shows that, I'll show you the result. The result is patients receiving intra-articular PRP injection got essentially the same degree of self-reported pain relief as did those receiving saline injection. So whether you give just a normal saline injection or PRP, it's the same kind of pain relief. There's no difference. Radiographic analysis also didn't favor PRP either. Medial tibial cartilage volume, that means the thickness of the cartilage, actually reduced by 1.4% with PRP compared with 1.2% decrease with placebo at 1 year. That means after 1 year, if you give a normal injection, if it reduces by only 1.2%, but if you give PRP, it reduces by 1.4%. That means cartilage loss is more if you give PRP injection. Again, another important publication in a journal called Clinical Orthopedic and Related Research. This is again a very, very reputed journal. Again, the headline says it at all. The no benefit of platelet-rich plasma over placebo injections in terms of pain, function in hemophilic anemia. Again, a randomized control trial. Okay. So this is an American Academy of Orthopedic Surgeons. American Academy of Orthopedic Surgeons is a professional body for orthopedic surgeons in US. It is a very, very, very reputed body which does extensive analysis of on different issues and gives guidelines to all the orthopedic surgeons in US and worldwide. Most orthopedic surgeons in the world will look at these guidelines to follow. So they again looked at platelet-rich plasma for knee osteoarthritis technology overview. Their conclusion, I'll show you their summary findings. PRP was not found to have any significant effect on cartilage thickening using ultrasound or knee strength. So absolutely no effect on cartilage growth at all. This is again I put it up because this is the randomized control trial in Bone and Joint Journal. So platelet-rich plasma injections for acute Achilles tendon rupture. So you may have come across some videos by social media influencers, bloggers, who are employed by these people, and then they'll start claiming that their family member had a tendon rupture, ACL rupture, tendon Achilles rupture, and they went to this center and they gave an injection and they're better. Really, do we need to learn treatments from YouTube bloggers and social media influencers? So these are the publications. Platelet-rich plasma injection for Achilles tendon rupture, 2-year follow-up, okay, randomized placebo-controlled superiority trial. Again, the conclusion. PRP injection did not improve patient-reported function or quality of life 2 years after acute Achilles tendon rupture compared with placebo. So this is the literature that is available, unbiased, good quality literature. So from this you can make out on your own whether this is a miracle treatment or this is a scam perpetuated by few people. The other thing, how is PRP procedure done? It's a very simple outpatient procedure. So I will show you the procedure in the video. So I'm going to explain how PRP is done. So we'll start with the taking sample first. It is a very simple procedure. It is done as an outpatient procedure in outpatients, in the consultation room usually, or a dressing room or an injection room. It does not need to be done in theater. It does not need too much of a setup, and it does not involve a lot of expenses. So we'll show you how it is taken. this is a sample that we have taken. Okay, so this is called centrifuge. It is a simple machine that is available in every laboratory. So we're going to keep this sample here. Okay, so we're going to keep 2 samples because it needs a counterweight. Okay, so it is kept in this here, and then close. This clear part here, this clear fluid, is now called platelet-rich plasma. That is the plasma containing platelets in this part. So this part we will aspirate with a needle. We'll aspirate with a syringe, and that is what is injected into the patient's knee. So this is platelet-rich plasma. The procedure is as simple as this. This clear fluid is platelet-rich plasma. We have taken two samples so that, okay, this is an adequate quantity. And now the platelet-rich plasma is in the syringe. So the knee area is cleaned with so that injection is given under sterile technique. So this is how the platelet-rich plasma is injected into your knee. That's it. So your knee can move a few times. Of course, under strict aseptic condition in the outpatient, and patient can immediately walk out after the size. But this is quite simple. So how do you pay more money, or to be able to charge more? This is showcased as if this is a major procedure. You know, you will be taken to theater. There'll be a lot of cleanings. There'll be a lot of screens that are put. A lot of colorful lights will be lit, and then some music is played, and then they'll take blood, and then they'll make you wait in theater for 1 hour. This is processed. Wait for another half an hour, and then you come back again. You're blinded. Screen has been put, and then this injection is given, and then you're put in ICU or observation room for a few hours. And so the whole thing is made to look like it's a big procedure so that you can be charged more. Most of the knowledgeable persons or the proper professionals who use this, they probably charge you 10,000, 20,000 like that. But these people who have no relation, no knowledge, are not qualified, charge you 2 lakhs, 3 lakhs for these injections. I see so many of these patients have actually taken loans, sold their lands in the hope that their mother or their wife or their family members will get benefit of this and will probably save surgery, and they go to these places, give these 2-3 lakhs, get these injections, and then their knees, actually many of these knees get destroyed, they develop infections, they end up with multiple surgeries and sometimes losing the limb also. No injections should be given into the knee lightly, except in some certain situations, because every injection may cause some damage. The other trick they show you is that the knee has a lot of fluid. It has to be taken out. No, not every fluid in the knee is to be taken out. Arthritis many times causes fluid in the knee. It is a protective mechanism. The body secretes fluid. Of course, if you have a doubt whether it's an infection or some gout, you want to take out for a diagnosis, yes. Or if patient has a lot of pain, to relieve pain, yes. But you need not take out this fluid every time. So they should do an ultrasound to show there is a fluid, as if only ultrasound shows the fluid. You can make out this fluid. It do not require an ultrasound at all. So this is a scam that is being perpetuated by few people who may or may not be qualified to treat arthritis at all, may not be qualified to have the knowledge to treat arthritis, but making false promise that this cures arthritis or grows the cartilage, and then looting innocent people and public with this scam. As a doctor, my responsibility, my loyalty is not to my colleagues or to my hospital. My loyalty and responsibility is to the society and the patients at large. So it is my responsibility to bring this knowledge to you, and I also request you It's also your responsibility as a medically aware person, as a person with some knowledge, to spread this so that your family members, your near and dear, or general public at large can save themselves from this scam. Please spread this to at least 10 people so that few more people can be saved from this scam. Thank you very much.